Okay. Good afternoon, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background of pediatrics and emergency medicine. Besides being a professional physician, I'm also involved with lots of community and outreach program and volunteering work. And one of the community outreach program is I host my own show called Health Talk on Bloomfield Cable TV. Here I invite all the guest speakers with their expertises, and we discuss the recent updates in the medicine. Today, our title is the updates on COVID-19 deadly virus, which we all know has become pandemic. And today also we are going to talk about the anxiety and the fear that we have, that our students are experiencing. So good morning. I will start with our University of Chicago students, Dillan. Good afternoon, Dillan, and welcome to my show.
Thanks a lot for having me, Dr. Prasad.
Can you give a little short introduction about yourself, Dillan?
Sure. Well, my name is Dillan Prasad. I'm a second year at the University of Chicago studying neuroscience, astrophysics, and pre-med. And unfortunately, just like most of the other universities in the nation, we're now fully transitioned into online remote learning via Zoom and Canvas from the safety of our own homes.
Okay, thank you, Dillan. Good afternoon, Chris.
Good afternoon. I'm Dr. Chris Shreve. I'm a mental health practitioner in private practice. Done a number of different projects in mental health and substance abuse, and looking forward to contributing my thoughts on this topic of the coronavirus, the COVID-19.
Thank you so much, Chris. We have always participated producing good videos. Good afternoon, Vilma.
Good afternoon, Dr. Prasad. You have a beautiful team here.
Yeah.
So I would like to introduce myself. I'm Vilma Drelichman. I'm Section Chief Infectious Disease at Providence Hospital. We have two hospitals. This is the Ascension Providence in Southfield and Ascension Providence Park. And we have been seeing a lot of COVIDs, and we are continues to learn about this new virus. So when it's my turn, I will add something.
Thank you so much, Vilma. You will add about the updates on it, what is being done at the lab, and how the diagnoses are made. I know everything is, most of the things are experimental, like the vaccine, but we will start with our student, Dillan. Could you please express your some of your thoughts? First of all, we will start from what you think about the young students, the school going students. How do they feel? And then we will talk about the graduating kids. A lot of kids are graduating this year, but they won't be able to have graduation. And now we are in the college. So could you give your insight on this? Give your opinion, and then Chris will be able to handle some of your questions.
Sure, sounds great. Well, from my perspective, I believe that students everywhere are being affected by this disproportionately, right? And it all comes down to age breakdown, right? Stage in school, and then access to resources. So I guess starting at the youngest age of things, people in middle school, public middle school or elementary school, even up until high school, there's a wild variation in terms of access to the resources that facilitate an environment that's conducive to digital or remote learning, right? So some people don't have stable Wi-Fi connection, or don't have the right, software or computers to even support the participation in that same school atmosphere. And due to that, I think we all really need to be cognizant, as policymakers have been, we all really need to be cognizant of these different inequities and how different people are accessing what would be an education for the rest of the year. there's certain uncertainty, right? There's certain anxiety about if school is going to resume as it normally would next fall. But I think everyone is mostly on the same page by now that the remainder of the academic year is going to be spent through e-learning. So at the younger levels, right, the pre-high school level, there's a lot of variation. So some people just have total outright cancellation of school, right? No remote activities, no learning, no engagement, things like that. And they're sort of just stuck at home with ideally their parents or guardians with some sort of structure, hopefully, right? But that's just completely up to them. That's completely subjective. And then as you get a little bit older, resource dependent, right? Public versus private school, or, just general access based on averages of the community, access to resources, internet connection, things like that. Then you have 6th graders, 7th graders, 8th graders having Zoom classes, right? It's certainly not like high school or college with the same level of structure, but there's definitely a gradation there. Like, for example, I have a younger brother who's in 7th grade right now, and he, along with lots of other 7th graders in our area, are still attending classes, but it's greatly reduced workload-wise, right?
So Dillan,
do
do you have any particular questions to ask our mental health specialist, Chris? What would you ask him? I know there is a lot of anxiety and fear going on, and he's the specialist.
Well, sure. And I mean, I think, you were walking all on my toes when you were talking a second ago. I have 2 daughters, and one's 8th grade, one's 12th grade.
Okay.
And, this has been a major disruption, as you can imagine, in terms of graduation and prom, and, all of these types of events that are tied to the academic school year, especially when you're graduating. So I have 2 kids who are both transitioning into graduation status. So, and I do really feel for them, and I feel for all the other students and college students, as this has been a big issue in terms of making the adjustment. I have actually been an online college instructor for about 15 years. And I was a big skeptic about online learning. But then when I got certified and started teaching, I realized it is actually a very effective modality once you make the transition. Unfortunately, it's not for everybody. And this transition has forced every student into this online learning modality. But like you said, there's a hodgepodge of different things going on. My senior, my daughter, she's done. She's done for the school year. She has, she's graduated. So there's a lot of things. So I think the anxiety is coming related to the future and, what is going to be the school model for the fall and what's going to happen for the rest of the school year. I think, we do have clear instructions now that they're going to finish 9 more weeks of school. And I think for some high schoolers, they're done. And so it's kind of all over the place. And I think it does raise a lot of anxiety, probably some real sadness that I'm picking up. We had to cancel spring trips, senior trips, graduation, activities are put on hold right now. So I think it is time where our kids are feeling a lot of anxiety and some sadness, because this is their year.
Anxiety, sadness, fear, anxiety, and sadness. Now, Vilma, do you have to add anything?
Yes, I just want to add something related to the anxiety, and I don't think it's just for the students, because I also have grandkids, and I know graduating from school, and they would like to have their graduation celebration and so on. But if you think about our profession as a physician, I can tell you that we change completely, because we cannot say, we are not going to see you, or you cannot contact us because of this pandemic, okay? So what we transform is that we are connecting with our patients via telehealth, and it's very easy, even I'm able to see the wound of my patient, I'm able to see their mouth, I'm able to see their rash. Obviously, I cannot touch them to examine other areas of the body, but I can give them direction, I can give them advice, I can call the pharmacist and give them the proper medications and refill their medications. Those who cannot connect via telehealth, I'm doing by phone, and then documenting in my notes. So, and the patients are, coming, and today I saw about 12 patients via telehealth, and I have normal hours, and it's working well for us. Obviously, we have a lot of nurses that have to take turn because there is not enough patient in the office for them, except for the infusion clinic where the patients come for antibiotic therapy, for other medications that they receive, chemotherapy, for our colleagues that are oncology, rheumatology, that they get biological. So we are moving, and hopefully we'll get better.
Hopefully for the best, right? Dillan, what you have to add?
From the Dillan, go Dillan.
Dillan, go ahead and add. And
I just wanted to ask a couple more questions of
Sure,
Dr. Shreve. I think Dr. Shreve's in a pretty unique situation with his background and his access to, like you were talking about, those modalities and those deliveries of said modalities of education. So what, Dr. Shreve, do you believe the long-term impacts of COVID will be on the state of education? I guess that's a pretty broad question, but maybe with respect to the primary school, middle school, elementary school level, because I think most people agree that this is just a taste, right? This is just the first instance of a truly global pandemic in today's society, and it's almost certain that within the next coming decades we'll have to endure and struggle through something like this again. So what I'd say reforms, maybe at the policy or the social level, do you believe people are going to undergo as a result of this?
I mean, you asked a very great question, and I mean, I think we could spend the entire show just really answering that question, but I think what we've seen is a transition, a paradigm shift instantly of a lot of institutions. I know my counseling field, we've gone from office to virtual in a matter of a few weeks, the entire industry. So I know that education is being greatly affected as well, K through 12 as well as higher ed. So I think that at some point, I'd like to think that we will get back to business as usual in K through 12. And I do see that online learning is here to stay. K through 12 and higher ed already had it. So I think what might happen is that there's going to be some students that I'm not sure. I think some school systems might remodify their whole educational delivery system. They may realize that there's cost savings by having students do classes at home and then maybe do some classes on campus. I would hate to see us lose the school system because I think there's a need for socialization, sports, and things of that nature. But I think what we've learned is we can pull this off. We can successfully teach students K through 12 and higher ed in all academic courses. We can teach them successfully through virtual learning. Now, you did raise a good point earlier about access and technology gaps and things of that nature. And those are real concerns and real considerations. But I think that education will change. I think we will broaden the model. I think schools might adopt online learning as part of their overall curriculum. And that might be part of an option. Like I could see in my counseling profession that going back to the office is definitely something that we're going to do, but I could also see that 2 days a week, I might still be doing e-therapy right out of my house, as well as still maintain. I have 3 offices, so I could see, changing that as well. So I think time will tell, but I hope that we do get back to a traditional model of being in school and learning. But I think it's been a great wake-up call, and I think the online component will offer students who have difficulty in learning in traditional classroom settings other options. And I think like if a student is out sick for a flu or surgery, then they can easily adapt to the online modalities. So I think schools have enhanced their learning delivery system by adding this component. What will happen to it after we're back to normal, if you would, it's hard to say, but I don't think it's going to just dismantle and disappear. I think we're going to always have online learning K through 12, and in most college education settings, we already have it.
I think that's a great point. Yeah, that definitely seems like we're moving towards a more hybrid model. It's super important to touch on something that you were saying, to recognize that there's a tremendous diversity of students, right? Regardless of the stage of, academic progression, there are people who, even if we were not in, a pandemic quarantine state, there are people who would be better served, right, with online learning in the first place because they don't really have access or resources to attend the in-person setting. So I think that hybrid model makes a lot of sense.
Plus the flexibility, it offers more flexibility. I mean, you can work during the day, go to school at night. You know, you can kind of fit the school model into your lifestyle. And I think it opens that up a lot wider. You know, I think the pandemic has taught us, we're going to learn a lot of things from this whole pandemic atmosphere that we're coming out of. I don't think we really know yet. I think all of us are kind of in a state of survival right now, sort of a fight or flight moment until we kind of come out of this. But I think we're going to see some real positive adaptations. And I think getting back to our infectious control doctor, I think we're going to see some revolutionary changes in our healthcare system. Doc, what do you think about that?
Well, you know what? I have done a lot of research on this subject. The American Academy of Pediatrics, they have come up with a very good guidelines about these students of different ages, what their problems are or how to solve them. So this is very good. And another good is, you know, I do a lot of CNN, and I have learned a lot about this whole thing about the virus. Seems like it has become Corona King has become like a friend.
Right, an obsession maybe.
Yes, yeah. So now I'm going to go to Vilma. And Vilma, will you please tell us a little bit, because you are the expertise of infectious disease.
Okay. I was just thinking maybe it's important to really start the beginning of this pandemic. How they get to this and the evolution of this pandemic. So we know that in early December 2019, a patient was diagnosed with an unusual type of pneumonia in Wuhan, China. And from there, you know, it took a little bit, maybe like 3-4 weeks, to really report to the WHO that is actually has their office in China, not far from there. And following that, you know, the researchers in Wuhan and in the Virology Institute, they started sequencing this virus that was obtained from a bronchial alveolar lavage of a patient that presented with the pneumonia. So after that, really what they found out is that this extensive travel from people going from United States to China, from China going to different other countries, they started, you know, increasing the numbers in Italy and other countries. And for sure, we did a lot of, not only just for business, but also for fun. You know, my children were in Spain with my grandkids, and just when Spain didn't have any cases, but when they returned, they already have 8 cases. So luckily, they didn't develop any infection when they were there. Myself, I was in South America, and actually when I came back the end of March, Argentina already has few cases, and by now they have over 2,000. United States continues to have an increased number. Today, they reported over 2.5 million cases. We are still going up in the United States. However, Michigan showed a little curve down in cases, and in April 2018, April 18, we started seeing the curve coming down a little bit. And in the hospital, actually, we are seeing less coronavirus cases now, and is much better. Initially, we have to take all these patients in the OR in different areas.
So Vilma, whatever I wanted to ask you, please, can you please tell us a little bit about the testing? Because I know
yes.
testing,
I think testing has been a lot in the news. Yeah. We have seen the president briefing on testing. I'm sure you've all seen. So there are 3 different types of testing, okay? The one that we know is for the diagnosis, what we are using is the rapid polymerase chain reaction, okay? Real-time polymerase chain reaction. What do they look for? This is a molecular study, and they look for the RNA of the virus. This is an RNA virus.
Right.
The genome of this virus is very large. And so it's the largest genome amongst all the RNA virus. You know that HIV is also an RNA virus. So this is, they check for RNA, and if positive, it's an excellent test. Very, very rare to have a false positive.
How
So
many days it takes before we know the positive or
usually, if there is an ABO machine that they can give you rapid tests the same day, they are, most of the tests, you can find out your test result in 2 to 5 days.
okay.
That's the first test. That's for diagnosis. Then you have the second test that you probably have been seeing in the news, the antibody.
Convalescent serum. It is for
The
the
antibody test, yes, the antibody test is a blood test. This
Yeah.
blood test, it can tell you that you have the virus, but it's also tell you that you had the virus, okay? This test is actually looking for an antigen, okay? So when the antibody, but they have a problem because the reason is not completely approved yet. The FDA has to approve. They call the EUA, the Emergency Usage Authorization. Why is that? This is a new virus. We don't know what is the cutoff of the antibody titer.
Yeah.
There is a cross-reactivity with other coronavirus, such as alpha coronavirus, which actually I developed an infection with the alpha coronavirus called coronavirus NL63. So there is 4 coronavirus that is in the alpha family, and this we have 3 in the beta, which is the SARS-1 that was in 2002, MERS that was in 2012, and now COVID-19, which is in 2019. So
they
what
are all
happened is,
cousins.
because of the
They're all
cross-reactivity,
cousins. Yeah.
the cross-reactivity also, they have to find out how to determine. But I'm sure we are gonna have it pretty soon, the antibody test. But the antibody test really, it can tell you you have it or you don't have it. So you cannot go for the antibody test to tell the patient you don't have coronavirus. You
So
need the
this is
clinical.
Vilma, this is the misfortune about this, you know. We know what it is so deadly, but we are unable to diagnose it, right? And the people who are affected, you know, like I do reading every single night. I'm sitting and doing all this, all these viral studies. 70% of the people are asymptomatic carrier, right?
But Dr. Prasad, I actually tell you that you cannot just go by the test.
No.
There are very, you know, it's very interesting. It's actually very clear clinical presentation. When you don't have your COVID test, if you look at the markers, they have markers. One of the markers is the inflammatory markers. So
Right.
you have the C-reactive protein, your cell rate, your D-dimer, your ferritin level, all those are elevated. Your LDH is elevated, okay? So, and your lymphocyte is very low, and your white count is very low, and your platelets is low. So if you have that, there isn't any other disease that is giving you all these things. So you don't need a COVID test right away.
No.
You can start treating as a COVID when you have those findings. And then when the COVID test, then you confirm it. But there are clinical characteristics that tell you this is COVID, okay?
So basically, it is all related to the inflammatory process in the body. And
Right.
people who have underlying diseases like obesity, high blood pressure, diabetes, they are more susceptible to this virus, especially
Correct.
those with the underlying lungs issue.
Correct.
So we don't have
Correct.
that much time left, but can you quickly tell us a little bit about the treatment? I know there is no definitive treatment.
So the clinical, we try to divide in mild, moderate, and severe, okay? If it's mild, those numbers that I just mentioned, the markers, If they are very borderlinely elevated, they can stay home, okay? They don't have shortness of breath. The pulse ox is 94, 95. They can stay home, but the physician must check on the patient every day because the worsening of the clinical aspect is at day 7, 10, and 11.
7,
So
10, and 11
yeah,
days.
and you repeat those markers in 48 hours, 72 hours. If they are climbing and if they develop shortness of breath, then it's time for them to go to the hospital. If they go to the hospital, if they have pneumonia, then they stay in the hospital. If they don't have pneumonia and the oxygen level is good, they go home. The treatment for the moderate and for the severe is the only thing we have right now is hydroxychloroquine.
Right, anti-malarial drugs, that has been there forever.
Right, that was for malaria. Right, actually the first one was chloroquine, but chloroquine give you retina problems, so they change it to hydroxychloroquine.
So now we don't have enough time to talk, but hopefully we will get all of you again. What is the last minute, 1 minute talk from Dillan about the whole situation? 1 minute, what would you say?
Well, I think some nice ending words would actually be better served coming from Dr. Shreve with the background on the psychology, really, and the anxiety and quelling, and really approaching critically the way that we think about a pandemic, not just as individuals and not just as families, but more so as a society, right?
Okay. Yeah, I think it's important, we're in this real trying time, and I've been talking to a lot of my patients about maintaining our routines as much as possible and grounding ourselves, maintaining ourselves in an alignment and a grounding so that we don't allow our overthinking minds to take this pandemic and then just spin us out of control mentally. And I think a lot of this is, getting back to kind of full circle, and I think Dr. Prasad, we probably need to kind of do a part 2 on this topic. I don't think we really just scratched the surface here.
We will do the part 2. No,
but
part
I think it's
3,
really
because
important.
part 1 we did already before, remember?
Absolutely. But I think it's important right now that, for college students, that we have a rollout plan that makes you guys feel safe entering back into the classroom space. And I think that that's going to be part of the anxiety and the stress that a lot of students are going to have transitioning back from virtual back to the classroom. So I think that's going to be a function of testing and knowing exactly who's safe and who still might have the virus. But I think that we will get back to a state of normalcy. We have changed as a people. We have changed as a country. And I just don't know if we know exactly what those changes are yet. I think there's going to be some good changes, which is what I'm looking for, but I also think there's going to be some negative things as well. Go ahead, Dr. Prasad.
I just want to add,
Vilma.
Yes, I just want to add something about, just like SARS-1 and MERS left, we are hoping that this is going to live too, okay?
Right. Yeah, hopefully it will live. Hopefully we will have peace. Now, I'd like to thank all of our guest speakers, Dillan Prasad, Chris Shreve, Vilma Drelichman, for joining me today on this updates of coronavirus. And then we will definitely have some more videos on the whole topic. Thank you so much. Thank you to
everyone. So much.
Have a safe.
Thank you, Dr. Prasad. Thank you to all. Thank you, Dillan. Thank you to doctors. Thank you so much.